Hi, everybody. My name is Mark Warshofsky. I'm the system chair of the Nuvance Health Heart and Vascular Institute. And welcome to the first in a series of discussions about heart and vascular disease. Today, we're very lucky to have Dr. James Lyons speaking with us, who is a nationally recognized expert in advanced heart failure. Jim is the director of advanced heart failure at Vassar Brothers Medical Center and a senior physician in the Heart Center. Jim is joined by Carolyn Kasov. Carolyn is a nurse practitioner who joined Nuvance Health about 6 months ago, and she is helping to run our heart failure program in Connecticut. So welcome to you both.
Thanks for having us, Mark.
Thank you.
So Jim, I think we'll start with you. Can you just tell us what is heart failure? I know a lot of people hear the term, but are not really clear about what heart failure actually is or does to somebody's well-being.
Sure. It's it's a scary term for a lot of patients. They hear the term failure, they think, they automatically often will think the worst. But it's really it's a term that encompasses a lot of different conditions that can affect the heart. But when it essentially boils down to any change in the heart function that causes it to work less efficiently. So, the heart essentially is a pump, and when it doesn't pump normally, patients develop symptoms from that. They get out of breath easily, they fatigue more easily, they notice that their legs may start swelling. But it's a number of different conditions that can be wrong with the heart that lead to the same symptoms that we call heart failure.
Great. And I've heard this term, I know a lot of patients hear the terms systolic heart failure and diastolic heart failure. Can you just go into a little bit about what the differences are in those two entities?
Sure. So from a patient perspective, and even from the emergency room perspective, patients with systolic heart failure versus diastolic heart failure really look the same. The symptoms they have when they show up in the office or when they show up at an urgent care center is very similar. It's that same things we mentioned before. They're out of breath more easily, they fatigue more easily, they don't have trouble sleeping at night because they wake up feeling like they can't breathe. But the main difference is in systolic heart failure, the heart muscle doesn't squeeze as well as it's supposed to, so it doesn't pump the blood as efficiently every time the heart beats. In diastolic heart failure, the heart becomes stiff and it doesn't relax as well in between beats, so it isn't able to fill up and pump the normal amount of blood forward.
Interesting. So, Carolyn, when you see a patient with heart failure in the office, what types of advice do you give them with regard to things like diet or other things that they can do to kind of mitigate some of the symptoms that they're having from heart failure?
Right, so when we see them in the office, a big component of the office visit is spent with educating patient and their caregivers, their family, about the heart failure, their diagnosis, and how we're going to help partner with them and manage this disease that they have. And one of them is medications. Another one, as you mentioned, is diet, some lifestyle changes, with educating them on the importance of weighing themselves every day, monitoring their fluid intake, and also spending a lot of time in education, monitoring symptoms that their heart failure could be worsening. So being aware of those symptoms to catch it early and knowing to call us sooner than later. We want to know as soon as we can to intervene, whether it be over the phone to change medications or to have them come in to see us in the office.
So there's really a lot that an individual patient can do for themselves to help their symptoms and help their disease state, right?
Correct. We encourage patients when they are feeling well to stay as active as possible. So that when they know their baseline, when they do notice symptoms creeping up with fatigue or swelling and they'll notice, yeah, I wasn't able to carry as many grocery bags with me going shopping, and I've noticed I had to take some more breaks, more than usual. So if they're able to stay active, they'll notice those symptoms a lot sooner.
Great, thank you. And Jim, if you see somebody who was referred by a doctor, or a patient came in and said, "Doc, I think I might have heart failure," or you suspected, how do you go about diagnosing them?
Sure. So first off, it comes from their symptoms, from the history. When they describe the typical symptoms of the swollen ankles, the not able to do as much, whatever their normal activity level was before, the waking up at night feeling like they can't breathe. Usually we can hone in on the diagnosis pretty quickly just from the patients telling us those symptoms. There are some things that we can look at on physical exam when we see the patient in the office, from listening to their lungs and looking at their legs, and again, that give us a very good idea of what we're dealing with. And then, in our offices, we also have the ability to do ultrasound or echocardiogram, which then gives us a more accurate reading of what their heart function actually looks like, and starts to clue us in as to what might be causing heart failure in their case. We do some confirmatory blood tests as well, which can help lead us to the right diagnosis. And then, depending on what we find with that initial evaluation, there's sometimes further testing that we need to do, because as I mentioned before, there's a lot of different heart conditions that can lead to the symptoms of heart failure.
Great. And in terms of resources in Nuvance Health for patients with heart failure, and their families for that matter, can you tell us a little bit about what's going on at Nuvance, and also maybe some, what's coming down the road, and what opportunities do we have to use new developments and technology to help treat these patients?
Sure. We have really the full spectrum available to us, from early patient education and disease management right up through, advanced heart failure and care for patients who may wind up needing heart transplant, and everything in between. I think the utmost and most important, which Carolyn touched on already, regardless of what the cause of your heart failure is, or whether you have systolic heart failure or diastolic heart failure, or whether you are, whatever the cause of whether you're in the early stage or a late stage, the most important thing for patients is their own lifestyle changes. Regardless of what medications we prescribe or what procedures we recommend or devices we recommend, they all still need to adhere to, changes in their lifestyle, with reducing their salt intake, trying to increase their aerobic activity if they can, taking their medications as prescribed. So at the base of everything we do is our patient education, which comes from our physicians, our nurse practitioners. We have here in Poughkeepsie, we have a support group available for patients and their family members and their caregivers to be educated on how they're being treated, and to recognizing signs and symptoms. We have the full spectrum of medical therapy, all of the approved medications that are guideline directed by our national societies of medications patients should be on. We help them get on the right medications, learn how they should take them, look out for side effects. We also have access to some newer medications that are currently under research studies. We're participating in both in the inpatient and the outpatient setting, participating in research studies for new medical therapies for treatment of heart failure, which is very exciting. This is something that hadn't happened for over 10 years, and now we have a couple of new agents that we're using in an experimental setting with some of our patients. And then for the sicker patients, so the more advanced patients who maybe still have symptoms despite taking all their medications and doing everything right, we have device therapy, starting with what we call dual chamber pacemakers, or biventricular pacemakers, which can help with patient symptoms. We have other implantable devices that can help us monitor patients before they get their symptoms. Something called CardioMEMS is one of the main ones that we're using now.
Yeah, I've seen that help a lot of patients in terms of, like you said, picking those patients up early to keep them out of trouble, and keeping them out of the hospital, which is great for obviously their quality of life.
Yep. Yeah, there's good published data for the CardioMEMS device and doing just that and keeping patients out of the hospital and improving their quality of life. And in our experience, we've seen the same results, if not better, in terms of preventing people from showing up in the emergency room or having to stay in the hospital and helping them stay at home and keep their quality of life. And that's a big push of things that I talk to all my heart failure patients about. I tell them we have a kind of a two-pronged approach to how we treat them. First and foremost, we want them to feel better. We want them to go back to doing whatever it is that they like to do, that they were missing out on doing because of their heart failure. So above anything else, we want to be able to do things for them that help them feel better day to day. And then the second part of it is the evidence-based things that we can do to help them live longer, to improve their heart function, to reduce their chance of dying from their heart failure or other heart conditions.
Great. Well, I want to thank you both for joining me for, I think, what was a very interesting discussion about heart failure in general and about the exciting things that are going on at Nuvance Health. Just as a closing, if there's a patient out there or, who feels like they have heart failure or maybe wants to get evaluated, what should they be doing?
So someone who has any of the symptoms that we talked about or concern about a potential heart condition should see a cardiologist, or at a minimum, at least get in to see their primary care physician and mention to them their symptoms and ask whether maybe they should be referred to see a cardiologist. Great.
All right. Well, thank you both again. This was, I think this will be very helpful for a lot of people.
I hope so. Thank you, Mark.
Thank you.